Hello everyone, my name is Sai Kumar. I chose the radio frequency identification technology. Radio frequency identification technology is a fast developing wireless tracking system which uses radio frequency signals to track the data. And radio frequency identification receives the data between a tag and a reader. Reader is also called as a transponder. After scanning the tag, reader or transponder sends the tag information to the database system, which analyzes, stores, and filters the data. After the useful information is passed to the enterprise application systems for further info operations. And database system contains multiple readers which are located at different places to transmit the data between wired and wireless networks. RFID technology is used in the applications such as product tracking, human identification, asset management, access control, security, and healthcare, universities, sports, etc. RFID technology is one of the technology which the health institutions is preferring mostly. It is growing rapidly because of its tendency to reduce the medical errors and improve the patient safety. And there are two types of RFID tags. There are passive RFID tag and active RFID tag. Passive RFID tags are used for drug authentication and patient identification, whereas the active RFID tags are used for tracking the staff, patients, etc. And the challenges of healthcare in providing the quality of care includes medical errors, high cost, inefficient workflow, fraudulent drugs, theft of medical equipment. Coming to the medical errors are resulting in the patient deaths, and every year they are increasing. The deaths are caused due to the medical errors are compared to the deaths caused by other diseases like AIDS and cancer. As the healthcare coming to the high cost, as the healthcare expenses are increasing, hospitals are choosing the alternatives to reduce the health expenses to improve the quality of care given to their patients. Inefficient workflow, which means the physicians, staff, or nurses are wasting their almost 30% of their time in retrieving the patient's information. So in that case, they should be provided with efficient EHRs or like that. Uh, Fraudulent drugs, the counterfeit medicines are creating a huge problem in the patient's care, and which are there are cases like you the it occurred the patient's death due to the use of these fraudulent drugs. And the last one is the theft of the medical equipment. The theft of the expensive medical equipment, medical assets, and supplies is one of the challenges which is facing by the hospitals. The recyclable medical instruments are discarded or by the hospital staff without the proper knowledge. And coming to the RFID applications in the healthcare, RFID applications in healthcare includes tracking, identification and verification, alerts and triggers, interventions, and sensing in the hospitals. The most widely used application in hospitals is tracking. Like as I mentioned before, there are two types of tags: RFID tags, passive RFID tags, and active RFID tags. Passive RFID tags are used to track the drug authentication, patient identification, and telemetry uh, transmitters, etc. in the hospitals. Active RFID tags are used to track the infusion pumps, staff, track the patients, track the wheelchairs and beds. And RFID robots were developed to track the expensive assets and equipments in the hospitals. And it not only tracks the valuable assets, but it is a technology which is improving the quality of care of patients by tracking the uh, patients, mentally disabled, and newborn kids. and drugs are applied with the RFID tags coming to identification and verification. Mm, one more cause of the medical errors is with the misidentification. Like it can be by the use of the RFID, it can be reduced. Positive patient identification applications, which uses the patient's wrist with the RFID tags. Whenever the physician or nurse scan the tag, it provides the reader with the information such as the patient name, age, treatment information, medical prescription, and insurance information. The disaster victim management and newborn identity confirmation are the applications of the positive patient identification. And coming to the alerts and triggers, by using the alerts and triggers RFID application in hospitals, the patients are warned in case of any explosions or hygiene monitoring during the emergencies in the surgery, and sometimes the physicians are placed with the scanning, the alert, surgery alerts. A scanning object with the hand of the physician detects the patient's body for any surgical items or sponges in the body. And by using the RFID interventions, hospitals can improve the automated care of the patients. um, and by using the interventions, the automatic discharging of patients, the time and level of uh, medicine of the patients and treatment can be determined by using the RFID. And coming to the sensing helps the hospitals in protecting the blood supply by sensing the temperature of it. Advanced monitoring of patients is supported by chemical sensing. Advantages of RFID in healthcare. With the adoption of RFID, the healthcare reduces the medical costs, improves the quality of care, and reduces the medical errors. The benefits of RFID includes time, reduced medical errors, real-time data access, improving the quality of drug supply. And RFID monitors the uh, patient and retrieves the information whenever it is needed, which improves the healthcare and reduces the medical errors. And by using the RFID tracking system in healthcare, it prevents the valuable equipment from misuse and improves the production of staff. And through the use of alerting services, it warns the patients in case of emergencies and surgical warnings. And it also identifies the required medical equipment in time, which saves the patient's life, and it also reduces the cost. Barriers of the RFID in healthcare: it includes interference, placement of tag, installation costs, privacy issues, and security concerns. Technical issues such as interference is one of the barriers of the RFID in healthcare. Use of the high power RFID transponder, it may cause the electronic devices, the medical devices may fail to scan. And the tag placement, which means the RFID transponder depends on the factors such as object, the angle, and the length or distance. Installation includes the hardware and software, and it costs more. And privacy issues such as misuse of the healthcare information which is provided to the another person, it is one of the privacy issue. And the security concerns is also the barrier of the RFID technology. For the future use, of RFID in healthcare, and it seems to be a effective the RFID technology in future in the following areas such as tracking blade infusion, identifying the fraudulent medicines and medical equipment, and tracking the staff and pharmaceuticals. And many experiments and research is going on nanotechnology, nanotechnology, and wireless technologies, so that when a patient is ingested with the RFID devices, he can be able to, the doctors or patients can be able to provide the patient's health information and his vital signs, and the patient, I mean the doctors can monitor the surgeries, alert in case of allergies, heavy dosage of medicines, etc. And these are the references. Thank you.